So this is grade 1. Now, what is grade 1? Breathlessness on unaccustomed exertion. Breathlessness on unaccustomed exertion is grade 1, which is normal, which is physiological. Then 2, same, when I'm climbing 3 floors every day, I'm not getting breathlessness. Today, same 3 floors, I'm getting breathlessness. This is grade 3, breathlessness on accustomed exertion. Okay, now one step down we come, grade 3. Grade 3, today, every day I'm going 3 floors. Today, 2nd floor only I'm getting symptoms. So that is breathlessness on less than accustomed exertion. So simple, more than accustomed exertion, less than grade 1, grade 2, grade 3. Grade 4 is at rest, breathlessness at rest. At rest, breathlessness is very bad, it is severe. It indicates that the underlying disease is very severe. Patient is breathless even while sitting or while lying down. So this is a functional class. Another new functional class also there. Last 10-15 years we are using NYHA, New York Heart Association classification. I think I have a slide. Can you just show it and send to Sadhu? Okay, you have this. Yeah, this is the New York Heart Association, the very popular NYHA classification. You should ask the patient about his functional capacity. This is called functional capacity. You should ask the patient, what is your job? When are you getting breathlessness? How long? So you can classify. You can put them in one of these 1, 2, 3, 4 classes. So it depends on the severity. Class 4 is very severe, and this is useful not only to find out the severity of the disease, but when you are treating, when you are giving medications, the response of the drugs, response of acute treatment also you can assess. This is also used as a prognostic marker. You should, this question you may get in examination. So you have a case of exertional breathlessness. Find out if there is any ischemic breath function. First of all, you should know whether it is cardiovascular, respiratory, or renal, or brain, or any other disease, metabolic. So this is called tempo of workup. Workup can be a planned run. You can't just ask everyone to do all the tests. You have to have some mental makeup. You make up your diagnosis, tentative diagnosis or differential diagnosis, and then if it is ischemic heart disease, if your myocardium is suffering ischemia, then you find out what is the cause. It is not always coronary artery disease, which is common, of course. Coronary atherosclerosis disease, or is it aortic stenosis? Is it aortic stenosis that is getting causing ischemia and patients having pain and breathlessness, or is it severe anemia? The heart is innocent. So anemia is there. Many times we see patients coming with 4 grams hemoglobin, 3 grams. We have seen 1.5 grams hemoglobin recently, couple of months back. One young girl came, so we had to treat. So severe anemia can also cause breathlessness. So here, heart is innocent. There is only a supply mismatch. There is no proper supply because hemoglobin is less, which carries the all vital important oxygen and other things. Then thyrotoxicosis. If the patient has thyrotoxicosis, hyperthyroidism patient, they can have breathlessness, they can have palpitation, they can have chest pain. So chest pain is not necessarily always, as I told you, chest-related symptoms can be originating in elsewhere. The heart is poor, heart is getting the brunt of the disease elsewhere. And supraventricular tachycardia, sometimes arrhythmias can also cause the breathlessness and chest pain. So this is the tempo of workup. You can make an algorithm how to go about, how to have an algorithm, and you will definitely reach If you go properly, you'll definitely reach almost near correct possible diagnosis. You should remember that. So this demand-supply mismatch can be because of the problem in the heart, because of the problem outside. As I said, even severe anemia can have ischemia. So correct diagnosis in the cardiovascular disease needs a complete history. History is very important. History. In history, you have to take the genetic history, past history, family history, diabetes, hypertension, obesity, smoking, all history you have to take. And of course, you have to examine the patient thoroughly. Cardiovascular system examination again is a beautiful, very interesting card. I'll be dealing with the cardiovascular examination in next few days. So, of course, when it is necessary, ECG you have to take, 2D echo you have to take, X-ray you may have to take, X-ray. I'll show you beautiful X-rays also. And some blood markers. Sometimes you have to do a lipid levels, sometimes to do cholesterol, sometimes you have to do BNP levels, and troponins you have to do. Sometimes you may have to doubt the diagnosis is in doubt. You may have to send the patient for angiogram and other tests or electrophysiological studies if you are suspecting a conduction system related diseases like complete heart block or supraventricular tachycardia or atrial fibrillation. Again, there are some genetic diseases where, for example, a patient with Marfan syndrome, they also can cause some deposits in the cardia, and they will have some cardiac-related diseases like Marfan patient can come with heart failure. It can involve your aortic valve, and patient may have aortic regurgitation-related heart failure. Similarly, hypertrophic obstructive cardiomyopathy, HOCM, we call it as HOCM, HOCM. This also can cause, is also a genetic disease. In the family history, you have to find out whether cluster, like I gave the example of this family of mine, my patients, you have to take the family history, especially when they are having a premature cardiovascular disease or death in their family. So because premature cardiovascular disease runs in the family. If somebody died at young age, the remaining family members should be alert because they may be having some genetic defect. And like Brugada syndrome, I don't know how many people have heard this. Brugada syndrome, which is supposed to be more common in the Far Eastern countries like Singapore, Malaysia, Hong Kong, Bangkok. So Brugada syndrome. The death can be any time.